Hi everyone, good Tuesday afternoon and welcome to GoLocal Live. I'm GoLocal News Editor Kate Nagel. I'd like to thank you for tuning in for our now daily update at noontime with Dr. Michael Fine, the former director of the Rhode Island Department of Health, to fill us in on a little bit about the latest with coronavirus, what to look for around the country and here in the state. Dr. Fine, thank you for joining us again today.
Hi Kate, it's nice to be here.
Well, as I imagine might be happening in the coming days and weeks, again, getting additional information here in Rhode Island on the latest on coronavirus. Just want to fill folks in, if you're just tuning in now, a passenger taken from TF Green exhibiting flu-like symptoms to the hospital. Now, this flight was on a Southwest plane from Orlando. According to airport officials, again, flu-like symptoms. Did not mention coronavirus in their release, said it is not CDC protocol to remove a passenger from a plane who simply is exhibiting flu-like symptoms. In the event that the passenger does have coronavirus, the airport said that would be under the Rhode Island Department of Health's purview. Also, the Ivy League has canceled the men and women's hoops tourneys. The season-ending tournaments are now postponed. So a couple of developments, and now that we have you here, Doctor, obviously things are transpiring daily. We've seen from Italy that the entire country is under self-quarantine. What, in your estimation, could be the worst-case scenario for Rhode Island?
Well, the worst-case scenario, if you look at the numbers out of Wuhan, where the epidemic hit the first time, the worst-case scenario is we get something like 7,000 people ill and about 500 people who need intensive care unit level of care,
okay,
and probably 250 to 300 deaths. These are estimates based on other experience. It may be different here, but that's what we're looking at if we can't prevent its spread and start working on that soon.
Do you think we'll get a sense, Doctor, from what we see in Italy with this countrywide self-quarantine that is, in fact, looks to be pretty well enforced? Will that be a litmus test, if you will, to see how a countrywide quarantine addresses coronavirus?
Well, I think we've already seen that in China. They've locked the country down, and they did that over a month ago. And that's been, if you believe the Chinese numbers, that's been very impressively effective, so that we see disease in Wuhan and in the province around it, but we don't see disease reported in the rest of the country.
And who specifically should we be testing, Doctor? The Department of Health, along with the governor, had an additional press conference yesterday announcing a state of emergency. Now that enables some federal assistance in the event need be, and of course can mobilize the Guard. Talked about those additional testing locations. Now those again are only for individuals who've contacted the Department of Health. The Department of Health assesses the situation, at which point tells them where in fact to go. Are we going to see any change in testing protocol, do you think, moving forward as it relates to the number of tests specifically that the state ends up having?
Well, I can't predict what the protocol changes are going to be. But as we get more access to testing, and I think that's been the problem up to this point, where we really haven't had enough test kits available. But as we get more test kits available, I'd like to see us start to test all the contacts,
yep,
and to start to do community surveillance in the communities around the places where people have been positive. The assumption is that only people who are symptomatic can transmit disease. That's a good working assumption when you have resource limitations, but some evidence from around the world that other people can transmit the disease, and people who are asymptomatic both carry and can transmit, and that's what we have to guard against. And we'll guard against that and find out about it when we start doing testing these other groups.
Tell us a little bit, again, that's been mentioned in these press conferences, about community surveillance. What exactly would that entail, Doctor?
Well, there are a couple of ways of going about it, and obviously we'd want CDC's guidance on a specific methodology. But you know, if I was going to design it today without CDC's input, I'd say, gee whiz, let's start testing everyone who shows up with a cough and a fever in the health centers and primary care practices in the areas within a mile or two of where people who have a diagnosed case live, just to see if it's spread in that community.
And let's talk about what that looks like to anyone who's exhibiting symptoms. GoLocal did have the opportunity recently, actually a couple weeks ago now, a Rhode Islander who had spent time in South Korea came back through Japan and said he was surprised when there were no checks at Logan Airport. Now, he mentioned temperature checks throughout South Korea and at the airport at Tokyo as well. Do we have that mass temperature taking type of equipment, doctor, here in the state? Do the states have what other countries around the world are utilizing?
Boy, I don't know the answer to that. You know, the Department of Health, in its division of infectious disease and epidemiology, has a number of great infectious disease nurses who can help monitoring or help the monitoring of people who are self-isolating. But those are fairly directed temperature-taking processes.
Yep.
You know, you go to the house of the person who's self-isolated and you take their temperature. I've not seen us put up in the United States people doing mass screening in general. Now, in community health centers, at least in the community health center in Pawtucket and Central Falls, people are being screened for temperature as they walk through the door.
Okay.
And so healthcare workers can do that, but I don't really know if we have the capacity to do it in the train station and in the bus station and in airports. And I think that's the process other countries are using.
That was one of the things that came up at the press conference yesterday afternoon, again, after when the governor had declared the state of emergency, called on the president to call this a federal disaster, again, for more resources, which we'll get into shortly here. But do want to reiterate what you had said, Doctor, and what has been reported by GoLocal Prov, very specifically as it pertains to hospitals and healthcare centers, nursing homes in particular. The state is implementing a very strict visitation policy and check policy. They went as far to say that if nursing homes could not have a dedicated personnel checking everyone who comes throughout the door, that they were going to have a no visitation policy. I'm assuming you think that this is the best protocol to take at this juncture to be so strict.
Sure, particularly for hospitals, nursing homes, health centers, primary care offices. You want to be as precise as you can and make sure that anybody who may possibly carry the disease be isolated.
At what point, doctor, would we look at, and what are the criteria to cancel schools? The latest news coming out of Massachusetts, Harvard University is telling its students not to return to campus after spring break. Now, we've seen a number of more cases, of course, up in Massachusetts, but Governor Raimondo pointing to that declaration of state of emergency, the close proximity, here we are in New England, to other states as well. But as it pertains to schools here, and of course this concern of parents and educators and government officials, at what point, what's the criteria for closing schools? Well,
I don't think there is a fixed and firm criteria, and that's one of the things that's important about a public process with public debate. Remember that when you close a school, you limit educational opportunities for kids who need those opportunities. And the closing of schools usually has a differential effect on poor and working people. That said, the science suggests that when there's an outbreak present, the sooner you close schools, the better off you are in helping contain the outbreak.
Okay.
Now, clearly, if you have widespread disease, so that there aren't enough kids in a class or there aren't enough teachers and other personnel to run the school safely, that's a criteria that says you pretty much have to close schools. But what's called the precautionary principle in public health, the notion that we do better off making sure we are very conservative when there is the public's health at risk, that principle suggests it's better to close schools as soon as you see clear evidence of disease percolating through a community.
And finally, for the purposes of today, Doctor, I do want to ask you again about what we've heard for measures for those folks who might be impacted economically. We did discuss this yesterday. Of course, those individuals for whom a 14-day self-quarantine who need that paycheck, of course, the governor has addressed some changes for unemployment insurance, TDI. But a couple of things not mentioned in the press conference that she addressed. Independent contractors who can't file for these benefits necessarily. And what we've been hearing from more here, Doctor, as well, is employers as it impacts them and their business from the bottom line. Of course, the governor has been calling on employers to be cognizant and recognize when employees need to self-quarantine and stay home. But the ripple effect seems to be keeps getting bigger. Are we doing enough?
Well, I think there are a bunch of challenges. Not only do I worry about employers and independent contractors, I worry about people who are undocumented,
yep,
who are the cleaners and the landscapers, and do lots of childcare around the state. And they really depend on their day-to-day and week-to-week earnings just to survive. So I worry about that group. I also worry about making sure that people who aren't native speakers of English are getting the message that the governor put out about what protections are available to them. Because I'm not sure that message really gets into communities. I spent some time with some of my colleagues yesterday, and the sense was that in Rhode Island's communities, at least in Pawtucket and Central Falls, the people really weren't understanding much about coronavirus or much about what protections are available to them. And the other thing I'll keep hammering on is the need to make sure that people who lose income don't get their power turned off.
Yep.
We have protections to protect people who are ill that are in place in the winter. But as we go from winter to spring, some of those protections go away. And I think it's really important to keep those protections in place, as well as to extend as much as we can universal sick time, so people have sick time they can use as well.
Well, I appreciate, again, your Skyping in. As we said, a lot of developments in 24 hours. Anticipate possibly the same as we look to check in with you tomorrow at noontime, Dr. Fine. But we appreciate your taking the time to Skype into you, our viewer, here on GoLocal Live. Again, daily updates with the former director of the Department of Health, Dr. Michael Fine, here on GoLocal Live. So, Doctor, thank you for joining us today.
Thanks, Kate. I look forward to talking to you tomorrow.
Okay. And we'll be back here on Live at 3 p.m. Jennifer Lawless, professor of politics at the University of Virginia, will be joining us for national politics. So till then, have a good afternoon, and we'll see you at 3. I'm GoLocal News editor Kate Nagel.